middle, left. Hi, Nicole. My name is Dr. Matt. I'm going to do your exam today. So go ahead and tell me a little bit about what's happening. Why are you here?
Well, I've had a really stuffy nose, and I've been getting these ear pains. It's ringing, and a little bit of a headache.
Okay. So headaches, ringing in the ears. Is that in both or just one?
I would say it's mostly in this left ear, but it's a little bit in the right as well.
Okay. So left ear. And pain. On a scale of 0 to 10, how would you rate your pain right now?
4.
And how would you describe it? Is it achy, dull?
Achy.
Okay. What about headaches? Are they localized in the front or they move more towards the back?
It's in the front.
Okay. Are you taking any medications?
No.
Okay. Can you please verify your date of birth for me?
February 3rd, 2002.
Okay. Do you have any allergies? Okay. And what's your approximate height and weight?
I'm 5'4". I weigh 100 pounds.
Okay. This is just so we know how to dose your medication if we end up prescribing anything today. Okay. So you said you're not taking any medications. You've been having these headaches for how long now?
Past 2 days.
Okay. Ringing in the ears, pain. Are you having any sore throat or any difficulty swallowing?
A little bit.
Okay. Okay. Are you able to eat properly, to drink fluids?
Mm-hmm.
Good? All right, that's good. We want you to stay hydrated. And tell me a little bit about your nose. Have you noticed any nosebleeds recently?
No, not recently.
Okay. And is there anything coming out from your ears?
No.
Okay, so no discharge. Okay, let's go ahead and take your vital signs. Okay, just putting gloves on. And we'll measure your oxygenation first. Okay, this will go on your index finger. This will go under your tongue. I'm going to have you hold it with your right hand, okay? Great. Okay, oxygenation is 95% on room air. Heart rate is 84. %96% of room air. That's very good. Okay. Let's go ahead and check this. 99.3 Fahrenheit. It's a little bit elevated. Did you have anything to drink before coming in? Okay. And I'm going to take your blood pressure. Okay. I'm going to have you relax your arm. I know you mentioned that you're not having any nosebleeds, but with your headaches, I think it's a good idea to have a base of how your blood pressure measures. (118/70). That's normal. It's not too high and not too low either. Just going to slide this down. Let's go ahead and listen to your heart. Okay, it's gonna feel a little bit cold. Here only S1 and S2. No S3, no S4. I'm going to listen with the bell. Go ahead and take a deep breath in and hold it for 1, 2, and 3. Breathe out. Okay. Go ahead and take a full breath in and exhale. Good. And again, take a full breath in and exhale. Okay. Going to listen to the sides as well. Just going to lift your right arm a little bit higher. Okay. Take a deep breath in and breathe out. And the other side. Take a deep breath in and breathe out. Good. I'm just going to have you turn and I'll listen to your back. Is that okay? Mm-hmm. Okay. Okay, take another deep breath in and full exhale. Again. Full exhale. And again. Full exhale. One more time. Okay, very normal breath sounds. Just stay right there. I'm going to percuss. Very good. I'm going to take a look inside your ears first. Go ahead and turn your head that way for me. I'm going to have you relax. Let me know if you feel any kind of pain as I'm doing this. Just taking a look to see if there is any redness around the tragus. Okay, go ahead and turn your head a little bit that way. Okay. You might feel a little bit of pressure. The ear canal does look inflamed. I'm not noticing any infection. Tympanic membrane is pro-gray. Just a little bit of irritation. Some fluid buildup. Okay, let's go ahead and take a look at the other ear. Any pain with this ear does seem to be a little bit more red. Okay, so go ahead and turn your head a little bit more that way. Not seeing any infection on the left side. Just some constriction of the canal. Okay. I'm going to perform an ear test. I want to see how good your hearing is. Go ahead and close your eyes. Tell me when the sound stops.
It stopped.
Again, tell me when it stops.
It stopped.
Okay. Now go ahead and tell me which position here is louder, 1 or 2. I'm going to have you keep your eyes closed. So this is 1 and 2.
2.
And this is 1, 2.
2.
This is 1, 2.
1.
1, 2.
1.
Okay, go ahead and tell me when you don't feel the vibration anymore.
I don't feel it. I don't feel it.
Go ahead and keep your eyes closed. Okay, I'm going to try a different frequency. I did notice a little bit of delay on the left side, and that's the affected ear. So just trying to see if you have the same difficulty here, okay? Go ahead and tell me when you don't feel the vibration anymore. Okay, good. Okay, turn your head just a tiny bit this way. Good. Okay. Going to take a look at your mouth. Is that okay? All right, so we're looking for any swollen lymph nodes, swollen tongue or anything abnormal around the cheeks, okay? I'm gonna have you say a big ah. Okay, the soft palate looks intact. I'm not seeing anything swollen. Tongue looks symmetric. Okay, just gonna lift it up a little bit to see if there is anything under. Salivary glands are normal. Okay, go ahead and give me a big smile and frown above your cheeks. I'm gonna have you keep them puffed. Don't let me unpuff them. Very good. Go ahead and relax. I have here a few tastes since we are checking your throat. I feel like we should definitely do a test and see if your taste is abnormal or affected. What does that taste like?
Not good.
Okay. Is that salty, bitter?
Bitter.
Bitter. And would you say you would associate it with almonds or strawberries?
The first one.
Okay. Okay, let's go ahead and try that one more time. I'm going to have you close your eyes. What does that taste like?
Oh, salty.
Salty. Would you say that you associate it with pretzels or bananas?
Pretzels.
Okay. One more time.
It was sweet.
Okay. Would you say that you associate it with coffee or cinnamon?
Cinnamon.
Okay. Let's go ahead and check the patency of your nose first. So you did say that you're having some stuffiness, right? On both layers or just one?
Both, but mostly this side.
Okay. So the left side, that could be the sinuses. Is it okay if I palpate your sinuses first? Okay, I'm palpating the part that doesn't look as red or inflamed. Let's just see if there's any difference. Tiny bit of puffiness there. Definitely more red over here. Okay, there's another set of sinuses right in between your eyebrows. I'm just gonna go ahead and fill that as well. Okay, I'm going to palpate on your eye as well, very gentle. Let me know if you feel pressure more on the left or right or both sides. Okay. All right. I'm going to cover one nostril. Go ahead and try to breathe in, breathe out through the other one. Okay. Okay. Let's take a look inside. Go ahead and look up for me. I'm not noticing any obstruction, but there are some glands inside your nose that are a little bit inflamed. We're just going to keep on investigating and see exactly what could be the cause. Let's try and see if your sense of smell, so your olfactory nerve, is damaged. You didn't have any accidents, correct? Any broken nose, and you are not into contact sports or something like that. Okay, so these smells might be kind of strong. Wait. There you go. If they bother you or they give you headaches, just let me know, okay? Okay, go ahead and close your eyes. And just gently waving the test tube around your nose. When you're ready, go ahead and tell me what this smells like.
It smells like mint.
Mint. Okay. I'm going to keep this one a little bit farther from your nose. Let me know if you can detect it.
It kind of smells like cinnamon.
Okay. Definitely, that was garlic, and then it was very strong, so that was one of the reasons why I didn't keep it so close to your nose.
Okay, that one smells more like cinnamon.
Okay, and this is floral. Sometimes it could happen that we're smelling something that is not there. It could indicate a nerve damage.
It smells like mint.
Okay. And one last one.
It smells like ginger.
Okay. I'm gonna have you change into a gown, and I'll have you lay down on the table, and I'll take a look at your neck and throat and see if there is any other damage that we haven't discovered yet.
Okay.
Okay, Nicole, I'm going to palpate first your lymph nodes. Let me know if you experience any kind of pain as I'm doing that. We're checking lymph nodes that surround the neck muscles, including cervical and thoracic. Sometimes throat discomfort could also come from an impinged nerve or a muscle that is swollen. Just going to turn your hand towards the right. checking lymph nodes that are above the collarbone. Is it okay if I open the gown a little bit on the side? Okay, checking the left posterior side of your thyroid gland. It's part of the throat exam, and we are expecting for it to be non-palpable. As you turn your head towards the right, I do feel a little bit of a lump, but that's because of how you turned your neck, so that's normal. And I'm not feeling any nodules, which means that the thyroid gland is normal size. Okay, I'm gonna have you turn towards your left now. I'm going to open the gown on the right side. Any enlarged lymphadenopathy above the right clavicle. Go ahead and turn your head towards the center. Just going to palpate your trachea now. Trachea is midline. I'm not sensing any obstruction. There's no inflammation around it. Okay, checking thyroid from the anterior side. I'm not feeling any lumps, and it's very hard to palpate, so that's good. Can you go ahead and swallow for me? Okay, very good. Checking preauricular lymph nodes in front of the ears and postauricular lymph nodes. The tissue is soft. I'm not feeling any bubble-like sensation. I'm going to palpate your head. Feeling for any asymmetry, lumps or bumps. Okay, I'm just turning towards the other side now to check the right occipitus. Okay. Palpating TMJ to see if I feel any inflammation around it. Moving that to the temporomandibular muscles that connect the jaw to the ear and cranium. So you're going to feel my fingers right under your eyes. Did you feel that equally on both sides?
Mm-hmm.
Did you feel that equally as well? Okay.
It was a bit harder on the right side.
Okay. Let's check that with you. looking for any abnormal muscle movement. Go ahead and open your mouth slowly all the way, as much as you can. And now close it slowly. Okay. I'm just going to move my fingers to a different point pressure. Go ahead and do that one more time. A little bit of anterior movement on the left side. I did not hear any popping. Let's do that one more time. Okay. Now I'm going to have you open and try to move the jaw towards the right. Okay. Come back to center. And let's do that one more time and move to the left. And come back to center. Okay, did you have any pain while you were doing that? Okay. Okay, so I'm gonna give you 3 numbers. 1, 2, 3. 3 is the worst pain. 2 is so-so. 1 is very little pain. Go ahead and tell me if it's 1, 2, or 3. So I'm pushing down.
1. 1. 2.
Okay. So these muscles are the ones that are affected. I'm going to touch you with 2 textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to be sharp. This is what sharp is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Dull.
sharp, sharp, dull, dull, sharp, sharp, dull, sharp, 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 dull, sharp, sharp.
Okay. Go ahead and tell me if you feel this on the left or right.
Left, left, right, right, left, left, right, 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 left, 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 right, right.
Okay. I'm gonna try to listen to your TMJ and see if I hear any microscopic sounds that can be picked up through the stethoscope only. Go ahead and try to open your jaw slowly. Okay, and close. And do that one more time. And close. One more time. And close. One more time. And close. Yeah, so just like I suspected, I did hear the cracking sounds, which are normal in your diagnosis. Let's go ahead and take some measurements. Okay, go ahead and open as much as you can. Okay, so that's 4.6. You can go ahead and close. What we can do today before we set you up with an orthodontist to try to fix the jawline, we can do a TMJ massage that really helps with inflammation and to subside the pain that you're having, especially in the back of your neck. The pain is coming from the front, and that's why you're experiencing some pain towards the left side, right under your eye here. So let's go ahead and start by applying an anti-inflammatory medication. It has 3 medications in it. One is anti-inflammatory, the other one is for pain relief, and the third is to increase circulation. Okay, warmed it up in my hands. Now I'm gonna go ahead and apply it. But just a little bit more. These are the pressure points that we're going to trigger to relieve pain. First, I'm using a lymphatic movement that helps to drain the liquid that is stagnant. Using a very gentle pressure. To apply acupressure. Let me know if you feel any kind of pain as I'm doing that, okay? We're trying to trigger the points that are very tight. applying gentle pressure. Okay, I'm going to go ahead and ask you to get dressed. Well, we will do another exam in about 2 weeks for a follow-up to see how this looks. In the meanwhile, I'm going to set you up with a TMJ specialist who's going to help you to rebalance your jawline, and that's going to cause a little bit less pressure on the TMJ. Okay, I'm going to prescribe some medication to help with stress and as well with the pain that you were having. Do you have any questions for me?
No.
Okay, thank you, Nicole.
Thank you.
What about now?
Oh.
I'm going to go ahead and take a look today at your TMJ.
Okay.
This is a follow-up for your orthopedic examination. And can you please verify your date of birth before we continue?
Yes, that's June 22nd, 1992.
Okay. And your allergies still the same, no known allergies?
Right.
Okay. All right, go ahead and describe the pain a little bit.
So I've been feeling this kind of like, I would say dull pain all around the ear. I was just recently diagnosed with TMJ disorder.
Okay.
I've also been hearing some like popping sound, mostly in my right ear.
Okay, most of the times, even though you hear the popping sound just on one side, it could be affected your both sides. It's just that you're not exhibiting any symptoms on the left side yet. But that's a good sign that only the right side is affected and showing symptoms, because it would be a lot worse to have both sides.
Okay.
So you said popping sounds, and is it constant or it comes and goes?
Pretty constant.
Okay, the pain, do you have any facial pain?
No.
Okay. What about inside your mouth, in the throat? Do you have any pain when you swallow?
No, I don't think so.
And any denture procedures in the last 6 years?
No, probably just like regular cleanings.
Okay.
Maybe a few cavities that they fixed, but
Okay. And are you having any jaw pain?
yeah, kind of when I move it more towards the right side.
Okay. Are you taking any medications on a daily basis?
I take ibuprofen here and there to try to help. Not every day though.
Okay. And is it helping with the pain?
Not really.
Okay.
So if it is TMJ and you were diagnosed with it, then ibuprofen doesn't really do much for a musculoskeletal thing that you are having. We're gonna go ahead and prescribe just a lotion that is topical, and you can apply it 3 times a day. It's going to really help with the pain.
Okay, sounds great.
Okay. And have you noticed any grinding at night or throughout the day?
No, I do tend to tense up my jaw a lot when I'm stressed,
Okay.
but not grinding.
Okay. The tension, do you feel it more on one side?
No, it feels pretty even.
Okay. Are you having any frequent headaches?
Yeah, migraines a lot.
Okay. And the migraines, do they tend to radiate towards the front side or the back?
I don't know, I have not paid attention to that.
Okay. Try to pay attention to that next time and let me know when we see each other.
Okay.
Okay. Okay. All right, we're going to do some tests first. Okay, we're going to start with just a gentle palpation examination. Okay. Any pain here?
A little bit. More towards the ear. Yeah, right there.
Okay. On a scale of 0 to 3, how bad is it when I press down here?
Maybe 4 or 5.
Okay. And go ahead and gently open your mouth. Any pain now? Is it increasing as you're opening it?
No, it's kind of the same.
The same.
But I did feel like it cracked or it popped a little bit.
Okay. And I'm going to just apply some pressure here on this trigger point. Any pain here?
A little bit less, maybe like a 2.
Okay. What about here?
No.
Okay. And here?
Very slightly, maybe like a 2.
Okay. And here?
Same thing.
And what about here?
No.
All right. Any pain as I'm pressing down here?
Yeah, a little bit.
Okay, go ahead and give me a number from 0 to 3. How bad is it now?
Maybe like a 2 on the right side. It was a little bit more on the left.
Okay, so it's a...
I'd say like a 4 on that side and 3 on this side.
Okay, what about now?
No.
What about now?
Maybe like a 1 or 2. It's very slight.
Any pain here?
Yeah, a little bit. Like a 2.
You do have encapsulitis on the right side, which is an inflammation of the joint, and that could mean there is also some fluid buildup. Okay. pain here in the back of your ear?
A little bit, like maybe like a 1 or 2.
Okay. What about here?
Yeah, it feels pretty tense in there. Maybe like a 3, 4.
Okay. In here?
No.
Alright, so there's a good sign that it's not traveling down the trapezius muscle and affecting this joint as well. And here.
Very slight, like a 1.
Okay.
Gets a little bit worse.
And what about here?
Yeah, maybe like a 3. Not down there.
Okay. Go ahead and tell me which side hurts more, okay?
Okay. Felt pretty equal. Right. The right, I think. Right. I didn't really feel pain. No pain.
I'm going to check your arms as well.
Okay.
Okay, I'm gonna have you put your arms like this above your head and let me know if you feel any pain as I'm pressing down here.
No. No. No.
What about now?
A little bit of discomfort.
Okay, go ahead and relax. Alright, I'm going to put this on the bony prominences. Let me know when you don't feel the vibration anymore.
Okay. No. 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 No.
Okay. Do you hear this equally on both sides?
Yeah.
Go ahead and tell me if you feel the vibration more on the left or right.
Feels pretty equal.
What about now?
Yeah, it feels the same.
Okay, tell me when it stops.
No. No.
Alright, we're going to go ahead and just check some neurological responses here. Okay. Go ahead and relax your jaw for me. Good. Okay, I'm going to close your eyes and I'm going to draw something on your face. I'm going to need you to tell me if you can identify the letter. So I'm going to use the alphabet letters.
Z. X. O. T. M. P.
Good. What number is this?
3. S. H.
What number is this?
Oh, 4.
Okay. Alright, I'm going to go ahead and take some measurements. Okay. There's about a 10-degree imbalance on the left and the right. What I'm going to do is I will start by adjusting your face a little bit. So you're going to feel my fingers kind of pressing on the joint and try to move it a little bit. This will help to stimulate the nerve endings to regenerate and to shift into the right direction. Okay. Any pain?
A little bit. It feels like a little bit of pressure.
As we're moving the muscles, you might feel some release. I'm going to apply some pressure on the lower side of your neck. This will help to release some of that lymphatic fluid that has been accumulated in this area, and it's really putting a lot of pressure on your joint. Okay, I'm gonna have you make some rotation movements. So let's go ahead and start with the left side first.
Okay.
And tell me if you feel any pain as you're
So
doing that. So just rotate your head.
It does.
Yes.
It does feel pretty tense.
Okay, and go ahead and change direction. Okay. All right, I'm gonna do some tests to make sure that your strength is still normal. All right, what I'm gonna have you do is I'll have you try to lower your chin. I'm gonna push the chin up, and I'm gonna need you to resist to that. Okay, good. And now I'm going to push your chin this way. I'm gonna have you put force the other way. Okay. Good. Okay. So that is pretty good. Go ahead and try to lift your eyebrows up. I'm gonna try to push them out down. Okay. You can go ahead and shrug your shoulders. Alright.
It does feel pretty tense though.
And it seemed like you were having some difficulty there too. Can you go ahead and put your arms in front of you? I'm gonna try to push them up. Don't let me do that, okay? And I'll push them down now. Okay, very normal reaction. I'm gonna try to open them. Don't let me do that. Okay, I'm gonna try to close them. Slight problem with the left side. Okay. Alright. Go ahead and tell me if you feel this on the left or right, okay?
Left. Right. Both. Both.
Okay. And are you having any pain when I'm brushing your skin?
No, not at all.
What about here?
No.
Okay. What about your face? Do you feel this on the left or right?
Left. Right. Both. Both.
Did you feel that equally on both sides?
Yes.
And now?
Yeah.
Was that equal?
Mm-hmm.
Okay.
Okay, so I think I'm gonna have you do an MRI. We're gonna do an MRI of the joint and we're going to diagnose it. Usually, the diagnosis goes from 1 to 5, 5 being the kind of like the worst scenario, but even those kind of cases we can still fix. So as soon as you get that done, we're going to be able to figure out exactly what the treatment plan is. But from my point of view, I think we are definitely good here. And as soon as I have the MRI results, we're going to ask you to come back to the office and we're going to talk about what we can do.
Okay, sounds good.
All right. Well, do you have any questions for me?
No, not right now.
Okay.
Thank you.
I'll talk to you soon.
Okay, thank you.
Exhale.
Sharp, dull, vibration. 1.
Good.
1. 1.
Hi, Sarah. My name is Dr. Mad. How are you doing today?
Good. How are you?
I'm good. Thanks for asking. So I have here your file. You're a transfer patient from another hospital. I'm just going to go over your medical history to make sure that I have everything before we do the exam, okay?
Mm-hmm.
When was your last checkup?
About a year ago.
Okay. Can you please verify your last name
Yes. Russell.
and your date of birth?
November 18th, 1998.
Okay, perfect. Do you have any allergies?
Just pollen.
Are you taking any medicine on a daily basis?
No.
Okay. Any surgeries?
No.
Okay, any recent headaches or migraines?
I've had a couple migraines in the past year.
Okay. On a scale of 0 to 10, how bad are they normally?
About a 6.
Okay, and how often do you get them?
Every maybe 5 months or so.
Do you know what they are triggered by?
I suspect stress.
Stress. Okay. Have you been under a lot of stress in the last year?
I'd say so.
Any recent changes at home or at work?
I've switched jobs twice.
Twice. Okay. Okay. Have you noticed any palpitations, difficulty breathing?
No.
Any vision changes? Okay. Any skin changes, discolorations, or eczema?
No.
Okay. And how is your sleep pattern? How long do you sleep per night?
Usually about 8 hours a night.
Okay. That's amazing.
Pretty regular.
Okay. And do you follow a normal diet?
Mm-hmm.
Okay. What about exercise? How often do you exercise per week?
My job's pretty active, which helps. But usually I go to the gym about 3 times a week.
That's amazing. Okay. Any family history of hypertension, thyroid disorders, any neurological disorders?
I think some thyroid stuff on my dad's side, but otherwise nothing.
Okay. All right, so I'm gonna go ahead and insert this into your file since you're going to be our patient here, and we'll take your vital signs to make sure that we have a good baseline for you.
Great.
Are you experiencing any migraines at the moment?
No, not at the moment.
Okay. Any pain anywhere in the body?
Some back soreness, but that's all.
Okay. On a scale of 0 to 10, how would you rate the back pain?
Probably a 2.
A 2. And is that constant or it comes and goes?
Comes and goes.
Okay. So this is going to go under your tongue. I'm just going to have you hold it for me.
Thank you.
And then this will go on your index finger. It's going to measure your oxygenation and your heart rate. And 98 to 76. Perfect. Perfect. Okay, so that is 98.6 Fahrenheit. That's very normal. And now I'm going to take your blood pressure. Is your left arm okay? So this is going to go on your upper arm. And you said there is no hypertension in the family. You're not feeling any palpitations, no headaches at the moment either. So I'm going to have you relax your arm, uncross your legs. Perfect. Just going to place this here. Okay, this is going to go right here. Okay, I'm going to have you relax. Blood pressure is 116/75. Okay, I'm just going to slide this down. And how tall are you?
5'4".
Perfect. I'm going to listen to your heart. So I'm just going to have you scooch a little bit closer. That's perfect. Okay, go ahead and relax. I can hear only S1 and S2, no S3, no S4. Going to listen with the bell. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to listen to your lungs in the front and then I'm going to listen to the back too. Go ahead and take a deep breath in and exhale. Breathe in. Exhale. Breathe in. Exhale. Is it okay if I listen to the back? Okay, I'm going to have you turn around towards the wall. Perfect. Go ahead and take a deep breath in and exhale. And again, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, exhale.
Then breathe out. Where is the pain located? On the back? The back pain. Can you go ahead and point it?
Oh, down here.
Lower. Or lower. Okay. And does it get worse when you're standing or sitting?
Standing.
Standing. How is the pain right now?
Right now it's fine.
Okay. I'm looking for signs of scoliosis or lordosis, which is a deviation of the spine, normal angle, and it could indicate that the vertebrae are moving, shifting in the wrong direction, and that would cause strain on the muscles around, nerve pain associated with it. I'm going to do a sharp or dull test. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Does this feel the same as this? Okay. Go ahead and tell me if you feel this pressure or vibration.
Pressure. Vibration. 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 Pressure. Pressure.
And does this feel cold or warm?
Warm.
What about now?
Warm.
And now?
Cold.
And now?
Warm. Warm. Cold. Warm. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Cold. Warm. 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 Cold. Cold. Warm. Warm.
Okay. So I'm going to have you change into our gown and we're going to go ahead and do a head exam first and move down. Going to put gloves on. going to start by palpating your face. Let me know if you feel any kind of pain. Palpating masseter muscles to check for any inflammation. Checking lymph nodes. Checking preauricular lymph nodes for any inflammation. Post-auricular lymph nodes. Also, we're checking thyroid gland to make sure that there is no nodules. Both wings are non-palpable. Trachea is midline. Palpating mastoid bone, which is the bone right behind your ears. Checking to see if there is any signs of mastoiditis, an inflammation of the bone that sometimes could be discovered through just regular palpation. Going to palpate your sinuses right in between your eyebrows. Sometimes we could notice a little bit of swelling, tenderness, redness. And right under your eyes. Just going to slowly palpate around the fossa, the orbital part is definitely very sensitive. Okay. Palpating the hairline to see if there are any nodules, asymmetries. I'm going to take a look at the scalp to see if there is any inflammation, if you're suffering from any disorders of the skin that may be a little bit difficult to assess. Looking at the hairline, noticing a little bit of flakiness, dandruff. So you might be having a combination of oily and dryness. But I'm not seeing any redness, so that's good. I would really like to take a sample and see if there is any fungi or bacteria that we are dealing with. So what I'm going to do is I'll apply a toner that helps to balance the pH, and then we're going to take a sample and send it to the lab. Okay. So we want to scratch off as many dermal cells as possible. This also helps to regulate the pH of the hair follicle. This is going to feel a little bit wet. Okay. So now we're trying to see if there is any redness that appears after the treatment. Okay. Normal coloration, normal hair distribution, no signs of alopecia. Okay, this is going to help to soothe any inflammation from the test that we did, just so that we balance the pH and allow for healing. Going to check your hearing. Go ahead and tell me if you feel this on the left or right.
Left. Right.
Okay. Go ahead and tell me when you don't hear the vibration anymore.
I don't hear it.
Okay, go ahead and tell me when you don't feel the vibration anymore.
No. I don't feel it.
Okay.
Stop.
Okay, go ahead and tell me which position here is louder. Position 1 or 2.
2.
1 or 2.
1.
Okay, so on the right side, there's definitely a little bit of imbalance. I'm going to go ahead and examine your abdomen. Okay, Sarah, I'm just going to go ahead and take a look at your abdomen. First, I'm going to listen with a stethoscope. This is going to feel a little bit cold. Normal abdominal sounds. Have you noticed any swelling, any pain?
No.
Okay. I'm going to go ahead and percuss. Just a gentle palpation to check for any organ enlargement. So we're checking all 4 quadrants. Here we have the liver that usually is encapsulated under the ribs. Okay. I'm gonna go ahead and close this. I'm going to take a look at your legs. I'm just gonna go ahead and just palpate to see if there is any edema.
normal temperature. Going to check pedal pulses. 2+, strong and symmetric. I'm going to check neurological response. Go ahead and tell me if you feel this vibration or pressure.
Pressure. Vibration. Vibration. Pressure. Pressure.
Does this feel cold or warm?
Warm. Cold. Cold. Warm.
Do you feel this pressure or vibration?
Vibration. Pressure. Vibration. Pressure.
I'm going to check your reflexes. I'm going to have you relax your leg. Just relax. Good. Good. Relax. Okay, a little bit diminished on the left side. I'm going to have you relax and just twist this. Perfect. Good. Same thing on the other side. Okay, very good. Go ahead and relax. Going to check your Babinski reflex. Good. Let me do that one more time. Okay, very good. Just looking in between your toes to see if there is any eczema, dryness. Maybe we can recommend like a special cream that can help with that, especially when you stand up for a longer period of time. It could affect our feet as well. I'm going to move your big toe either towards you or towards me. Go ahead and let me know which position you feel.
Towards me. Towards you. Towards me. Towards me.
Okay. Go ahead and wrap your toes around my fingers. Okay. I'm gonna push towards you. Don't let me do that. Okay, I'm going to push them away. Don't let me do that. I'm gonna try to open them. Don't let me do that. I'm gonna try to close them. Don't let me do that. Okay, good. Motor strength there. I would say 4 out of 5. That's perfect. Okay. I know I already palpated your back, so I'm going to go ahead and listen for any abnormal sounds. You can go ahead and just breathe normal and relax. hearing a little bit of crackles at the base of the lungs. But only on the right side. I'm not sensing any inflammation around the spine. It is normal size. Going to check hydration status. Go ahead and tell me if you feel this 2 or 1 pressure points.
1, 2, 1, 1, 2, 2, 1, 1, 2, 1, 2, 2, 1, 1, 1, 2.
Okay. The same thing. Go ahead and tell me if you feel this 2 or 1.
1, 1, 2, 1, 2, 1, 1, 2, 2, 1, 1, 2, 2, 1, 2, 1, 1, 2, 1, 2, 1, 2, 2, 1, 1, 2, 1, 1.
Take some measurements to check for asymmetry. 42. About a 2-degree difference, which is not indicative of inflammation in the back area. I'm going to go ahead and run a few more tests, and we're going to take some x-ray of the back just so that we rule out any scoliosis or lordosis of the back spine. Okay, something that could definitely explain your back pain and also the migraines. So I'm going to have you get dressed and we're going to discuss the results. I'm going to take off my gloves and I want to do a one quick exam. So check your vision and your pupil response. There you go. I'm going to have you look right here. Okay, I apologize for the light. Go ahead and look up for me. Okay. I'm not noticing any yellowish discoloration. Okay, eyes are symmetric. Go ahead and look right here. Look right here. Okay, how many fingers am I holding? 2. Go ahead and cover one eye. How many fingers am I holding now? 2. Okay, go ahead and cover your other eye. How many fingers am I holding now? 2. And now? 1. Okay, very good. Okay. So Miss Russell, everything looks good. I think the migraines might be from a lack of caffeine. So I do recommend that you start a low dose of caffeine. That will help to stimulate your nervous system and take it only as needed. So it doesn't have to be on a regular basis. Just probably when you feel like you get a new migraine. Okay. And then we're going to run some x-ray of your back just to check for any scoliosis or lordosis, something that could definitely either trick the migraines and the back pain. But otherwise everything looks good. And I'm hoping that the x-ray will reveal what we're looking for.
Sounds good. Thank you.
You're welcome. Just gonna go ahead and write this down. So do you have any questions for me?
No, I don't think so.
Okay.
Sounds good.
Thank you so much for coming in. I'll see you soon, okay?
Yes.